We begin tonight, though, taking you through the term now dominating the headlines, triple-demic. It is how health officials are describing the burden on our healthcare system as cases of flu, COVID-19, and RSV are all up across the country. These are the case numbers in the most recent data available compared to 1 month prior. New York State reporting hundreds of RSV cases, 23,000 new COVID cases, and 27,000 flu cases. Western New York now reporting one of the highest per capita flu rates in the state. There are 147 new flu cases per 100,000 people. Zeroing in now on flu cases for the first time since the COVID-19 pandemic began, more people are in the hospital with the flu, according to officials, than COVID. In Erie County, nearly 1,500 were hospitalized with the flu the week of Thanksgiving, up 66% from just the week before. And county health officials telling us tonight that they are seeing a rapid and earlier than usual increase in these cases, and doctors blaming this virus surge on our compromised immune systems, which they say got used to a new normal of masking and social distancing during the pandemic. 7 News reporter Michael Schwartz talking with local health experts tonight about building back our immunity.
Flu cases surging in New York. These numbers from the state's Department of Health show Thanksgiving week was the worst week for flu cases in the past 3 years by far. Western New York is one of the hardest hit parts of the state.
We're in the midst of a large influenza surge right now. And in fact, we have the largest number of influenza cases per capita of anywhere in New York State.
Dr. Thomas Russo, chief of Division of Infectious Diseases at UB, says after protecting our immune systems from COVID for almost 3 years, we've become more susceptible to catching what's going around.
We were exposed to a minimal number of non-COVID respiratory viruses. And as a result, our immunity was not reinvigorated.
On Wednesday, Governor Kathy Hochul addressed the winter threat, calling it the triple-demic, as RSV, influenza, and COVID-19 cases rise across the state, slamming hospitals.
It's very busy right now. Obviously, Children's Hospital was hit very hard with RSV, and that's starting to wind down a little bit.
Dr. John Selleck, epidemiologist at Kaleida Health, says Buffalo General and Millard Fillmore Suburban are seeing a high number of COVID and flu cases, along with some RSV adult patients.
We've been incredibly busy.
Associate Medical Director Dr. Sam Cloud says ECMC is seeing much more flu activity now than in years past.
Having 7 to 10 influenza patients admitted at any one time, whereas, in, say, 2018, 2019, you might have 2.
All of this a trickle-down effect from COVID-19.
We are probably 40 to 50 patients more in the hospital than we would be prior to this pandemic.
If we can get through this winter, I think our immune systems will catch up, and next year we should settle into a more normal pattern.
And remember, if you feel sick, stay home. As you may be able to hear, I'm overcoming a bad cold that kept me home the last 2 days. This was right after a week of not great sleeping. Sleeping, one of the most important things you can do to improve your immunity. Doctors also advise you to eat healthy, exercise, find ways to reduce stress, get the proper vaccinations, and hydrate. Water is crucial to your immune system. Dr. Selleck says a high fever and shortness of breath are all signs to get that medical care at the hospital. Leah, Mary Beth, very big on taking zinc as well.
Yes, all good advice, and we are glad that you are back and healthier.
Thank you.
Thank you, Michael.